All right, well, good morning, everyone. We're going to go ahead and get started. Thank you all for being here this morning. I'm Amanda Sternberg. I'm with the Homeless Action Network of Detroit, and we are going to be talking today about the request for proposals, or the RFP that we just released for a new Continuum of Care, or CoC, funding for the fiscal year 2024 competition. So this webinar is going to go over the details of that application process. And so that's why we're here today. So a couple of housekeeping items before we begin. Everyone is on mute, but feel free to ask questions along the way. You can either drop them in the chat, raise your hand and come off of mute, whatever it works best for you. So you can definitely take questions along the way. But if you're not speaking, just do ask that you please keep yourself on mute. Also, this webinar is being recorded, so the recording and the slides will be posted to HAND's website by the end of this week. Later on in the webinar, I'll be showing that website so you know where to go, so you can access this afterwards as well. The attendance here at this meeting is not mandatory in order to apply for funding. It certainly is required. Encouraged, not required, to view this webinar if you do intend to apply. But if you are viewing this recording after this live session, you are still eligible to apply, even if you weren't here today. All right, so what we're going to be talking about today, which is the app, and I have on my screen here some of the highlights of what we're going to be going over. So we're going to be talking about just the application process, the types of applications that applicants may apply for, again, types and the amounts of funding that we anticipate having available, some of our new project funding priorities and target populations. We're going to be talking a little bit about applicant and project requirements, performance expectations. Going to be going over in some detail the budget spreadsheets that will need to be uploaded in the online portal. So we'll go over those in some detail. And then we are also going to be going over the online portal itself kind of towards the end. So this is a high level of what we're talking about. Everything that I'm going over is also given in more detail in the request for proposals itself that we released. So if you feel like some of the things I'm touching on are kind of high level or not going into a lot of detail, part of that's because we go into more detail in the RFP packet itself. And so we wanted to kind of direct you back there too. So a couple of caveats, one main caveat as we enter into this is that the FY2024 or Notice of Funding Opportunity has not yet been released by HUD. We always every year kick off our local application process even before the NOFO is released. But because the NOFO has not yet been released, we don't know with precision how much funding we have available. We have some estimates and some guesses based on prior competitions, but until the NOFO is released, we won't know for sure the amount of funding. Likewise, everything that we're talking about is, again, based on prior competitions, based on our best understanding of types of projects that will be that can be funded, all that sort of thing. But if anything changes after the NOFO is released, we will communicate that accordingly. So as I mentioned, everything from today is going to be posted to our website. And so you see the link there. I'll drop the link in the chat later on as well. So this recording slides will be posted there. Also, the budget spreadsheets that we're going to be going over, those are posted on our website, as well as the CAM governance letter of support, which we'll be talking about as well. Also posted on our website are a copy of the actual questions that you will be seeing in the online portal. We put those together just to help you kind of prepare to anticipate what questions you're going to be seeing once you get in and start working on the application. So when are things due? So the applications are due, they are due by noon on the night, on the 29th. I'm struggling with my words today. July 29th, that's a Monday. applications are due by noon on that day. So don't wait till the end of the day to get it in by noon. Anything that is submitted after 12 o'clock p.m. or noon on July 19th will not be reviewed. So take note of that deadline. Applications do also need to be submitted via the online portal. Any applications that are submitted in another format, if anything is emailed to me or any other format than the online portal, will not be reviewed as well. We anticipate that the Detroit CoC board will be making funding decisions in early September. So after your application is submitted throughout the month of August, they're going to be reviewed, and then recommendations will go to the CoC board in early September. That's where we anticipate they will make those decisions. Again, this timeline may be subject to change pending the release of the NOFO. So I want to walk through just a little bit kind of the steps in this application and decision-making process, particularly if there are folks on this call that have never applied for CoC funding before, or if this is a new kind of process to you. So kind of the first step in this process is that the CoC releases the local request for proposals and applications. So that is what we have done. We released that last week. Everything that went into the RFP was developed through the work of our committees and approved by the board. So that is kind of the first step. We released that local application. Now you are at the point where you may be responding to and applying for those funds. So after the applications come in, we have a team of reviewers who will review, evaluate the applications, and from that make recommendations to the CoC board on which projects should be submitted to HUD for funding. Ultimately, the CoC board will make that decision on what is submitted to HUD and what is not submitted to HUD. Projects are then submitted to HUD, and that submission goes through a different process as another online portal, which if that applies to you, we'll walk you through that as the time comes. But once the applications are submitted to HUD, they're submitted in a ranked order as well. At that point, then HUD does their own review of the applications, and HUD makes the final funding decision on what is actually awarded funding. And HUD's decisions are based on a number of factors. One is their own review of the applications, but their funding also depends on the amount of funding that overall is available and how well the CoC scores on our CoC competition. So there's a couple of different factors that come into play with HUD's funding decisions. But I just wanted to kind of lay this out to emphasize that at the end of the day, ultimately HUD makes the final funding decision on what gets funded and what does not. Everything that we do up until then, obviously we're submitting applications to HUD that, to the best of our understanding, are going to align with HUD's priorities, that are going to be reviewed favorably by HUD. But at the end of the day, HUD makes the final funding decisions. And I realize I'm using the term HUD, that's the Department of Housing and Urban Development. So that's the federal department from which all of these Continuum of Care funds come. So as we get into this presentation, and as you may have seen in the application materials, we use the phrase new and expansion to refer to the types of applications. So I'm going to take a moment to kind of define those terms and what we mean by them. So when we talk about new projects, these are projects that do not currently receive CoC funding in the Detroit CoC. They don't currently receive any CoC funding. Those are considered new. Expansion projects are projects that do currently receive CoC funding in Detroit, and they are requesting additional CoC funding to either add more units or add more services to an existing project. So they're looking to expand an existing project. If an expansion project is funded, HUD will just issue one grant agreement for that entire project. They're essentially going to take the existing project funding and then add to it that new funding that was awarded, and it's essentially making one larger project out of it. So both new and expansion projects are considered new projects. And I realize that might be a little misleading because we only use the word new in a couple different ways here, but they're considered new projects in that they are both applying for these pots of funding that are considered new funding, CoC bonus or domestic violence bonus funding. They're considered new projects in terms of how they're reviewed locally within the CoC, and they're considered new projects in terms of how HUD reviews them and makes their funding decision as well. So both new and expansion are considered new projects, and they're funded with new project funding. So in terms of trying to maybe figure out if the project that you're applying for is a new project or an expansion project, I put together this little flow chart, which hopefully will kind of help answer that question. So the first question to ask is whether or not the project that you're applying for, does it currently receive CoC funding in the Detroit CoC? If the answer is no, then it's a new project. If the answer is yes, and then if you ask yourself if you want to apply for additional funding to add more units, add more services to that project, then you have an expansion project. If you have an existing project and you're not interested in applying for additional funding, then you're just going to go the route of applying for renewal funding, which those applications were already submitted about several weeks ago, and that process is already underway. The evaluation criteria is different between new projects and expansion projects. This is given in detail in the RFP. The final pages of the RFP go into a lot of detail on the evaluation criteria, the point values, and what's looked at in that evaluation. Expansion projects are going to be evaluated more heavily on their past project performance. So how the project performed over the past year. That's going to be weighted more heavily than if it's a new project and looking back on how the agency may have performed. So take note of the evaluation criteria that's in the RFP. We're not going to go over that evaluation criteria in great detail on this call, just because there's a lot there. But again, it is all detailed out in the RFP, the specific elements that the reviewers are going to be looking for and the point values associated with those review elements. All right, so what types of projects can you apply for? I'm going to run down this list of the types of projects. Again, for today's purposes, we're not going to go into a lot of detail on what these project types are. In the RFP, there's a section that defines some terms, and in that section of definition, there is a little bit more detail given to what these project types are. If you are interested in learning more, you can feel free to reach out to me. I can direct you to some resources that may help you familiarize yourself even more with what these project types are. But to start with, so let's talk about the types of projects that you can apply for. So the first is permanent supportive housing, or PSH. This is a project type that serves people who have pretty significant barriers to housing. It provides a long-term subsidized housing opportunity, long-term meaning indefinite. There's no time limit on how long someone can be in a PSH project. And the people who are served in a PSH project, as I said, they have barriers to housing, they have a disabling condition, and they are, all of these projects are prioritized, referrals are made to these projects in accordance with our referral priorities, which we'll touch on in a few minutes as well. For PSH projects, they can be either scattered site or project-based or site-based. So briefly, what we mean by that, scattered site essentially means that the individual that you're serving would have the opportunity to locate and rent an apartment of their choosing within the CoC jurisdiction. There's certain criteria that need to be met in terms of housing quality and affordability. But for the most part, when you think of scattered site, think of, we're looking at kind of all the apartments, houses for rent within the Detroit Continuum of Care. A project-based or a site-based project, on the other hand, is where you're going to have essentially all of the units associated with that project in one building. Sometimes it might be one or two buildings, but essentially all of the units associated with that project are physically located in a specific building. The other project type is rapid rehousing, or RRH. Rapid rehousing provides a time-limited assistance to individuals. It's up to 24 months of rental assistance and supportive services. Rapid rehousing are largely, they are scattered site projects, so they're renting apartments or units throughout the CoC's jurisdiction. For rapid rehousing, we will be funding some rapid rehousing projects with our domestic violence bonus dollars. So some projects will need to exclusively target people who are fleeing domestic violence. The next project type that can be applied for is what's called the joint component transitional housing rapid rehousing, or THRRH. This is a project type that combines both elements of a transitional housing program with the rapid rehousing program. So on the transitional housing, or the TH side, you're going to have this often kind of a site-based situation where people will stay for a short period of time to get stabilized before they move on to rapid rehousing or move out to another permanent housing situation. We are only funding these joint component project types with our domestic violence bonus dollars. So these project types will be limited to serving people who are fleeing domestic violence. And the last project type is our coordinated entry SSO. This is a project type that provides funding to provide the services of our coordinated entry system, or CAM, for those of you who are familiar with CAM. So this provides funding to provide access point navigation activities for coordinated entry. So we do have some limitations or things to note about applications for new coordinated entry funding. The one is that for applications for coordinated entry with our CoC bonus dollars, which is a more broad pool of funding, those applications are going to be limited to our current recipients of coordinated entry funding. So those will be expansion projects to expand any of those existing grants. We will also be accepting applications for coordinated entry grant funded with our domestic violence bonus funds, and the applications for that project type is open to any entity that meets HUD's eligibility criteria, which we'll get to in a moment as well. Agencies are welcome to apply for more than one project type. There's no limit on how many project types you can submit. It's up to you to make that determination. Each application will need to be submitted separately through the online portal. So project types that are not being considered this year, I referenced this earlier, this joint component project type, we are only going to be funding those with our domestic violence bonus dollars. So we're not going to be considering those joint THRRH projects that may be funded with CoC bonus dollars. We're only going to fund those with the DV dollars. We are also not considering new dedicated HMIS projects this year. Dedicated HMIS is funding that would only be eligible to be received by the HMIS lead agency. The HMIS lead agency, which is currently HAND, has indicated that they have no plans to apply for additional funding this year, so we didn't even release that application. Individual project applications, when you are putting together your budget, submitting your application, you will be able to request an HMIS budget line for your individual project. So I don't want this to make it sound like you as an individual application can't request HMIS funding. You certainly can. This dedicated HMIS is a specific type of funding to support the work of the HMIS lead agency. Additionally, types of projects that we are not able to fund, new standalone transitional housing projects, we are only able to fund a standalone renewal transitional housing, of which we do have one in the CoC that we do continue to fund. We are also unable to fund new safe haven projects. That's not allowed under HUD. We are also not allowed to fund new standalone supportive services only projects that are not coordinated entry. We cannot fund emergency shelters, nor can we fund prevention programs. So this is a list of the project types that we are not able to fund. So if you're here hoping to be able to receive funding for one of these project types, unfortunately, they're not eligible to apply for funding. I referenced this a little bit earlier, but just to emphasize that the amount of funding that we have is currently unknown. We won't know that until the NOFO is released, and really until we finish our review of our renewal applications. There are 2, potentially 3 sources of funding to fund new projects. There's reallocated funding, which is funding that would be reallocated from a renewal project. The CoC has at times opportunities to reduce the budget of a renewal project and then use that funding to put towards new projects. We won't know if there's any reallocated funding available until later in August, once we finish the review of our renewal project applications. We do anticipate then, so the 2 main sources of funding that we will have are what's called our CoC bonus and our domestic violence bonus. So these are 2 separate, essentially think of them as 2 separate pots of funding that we can apply for funds with. So this chart here gives an overview of the types of projects that we will be considering for the CoC bonus. And you see reallocated funding and CoC bonus. Because if we do have any reallocated funding, we would combine that with the amount of CoC bonus funding that we have. Again, it's unknown at this point if we'll have any reallocated funding. Our estimated amount of funding that we think we'll have is $1.5 to $2 million. That's based on past competition, so that's our best estimate. You can see here that, again, the types of projects that we will consider, either new or expansion. This is just sort of a repeat of what I've already gone over. We will be considering permanent supportive housing and rapid rehousing, either new or expansion projects of those types. For coordinated entry, we will only be considering an expansion project, because again, the eligible applicants for coordinated entry with our bonus funds is going to be limited to our existing coordinated entry recipients, and therefore their project would be considered an expansion. And as referenced earlier, we're not considering applications for dedicated HMIS or the joint component project type with our CoC bonus dollars. For our domestic violence bonus funding, again, this is a separate pot of funding. We cannot combine DV bonus and CoC bonus. Those 2 sources of funds can't be combined together. So the domestic violence bonus is a separate pot of funding. We're anticipating to have about $2.5 to $3 million in DV bonus. Again, that's an estimate based on our best guess. So, excuse me. You can see on the chart here the 3 project types that we will consider for the DV bonus. These are all the project types that HUD allows us to fund with DV bonus. So rapid rehousing, the joint component, THRRH, and the coordinated entry grant. So all 3 of those project types, we're considering applications for either new or expansion projects. I will say too that an existing CoC rapid rehousing project could apply for DV bonus expansion funding to expand that non-DV project to add additional units or services, particularly to people who are fleeing domestic violence. It could be a little complicated to administer that way, but it is something that is allowed. If you currently have rapid rehousing funding in the Detroit CoC, and you want to talk more about that, happy to talk more. But essentially, you could expand a non-DV rapid rehousing, apply for DV funding, and if that's granted, that portion that's funded with DV would need to be dedicated to people fleeing domestic violence. So just wanted to make that comment. So again, there's no limit to the amount of funding that any one project can request in your application. I would ask you just be mindful of what we had said earlier in terms of the total amount of funding that we anticipate having available. Kind of keep that in mind as you're putting together your applications in terms of the total amount of funding that we have. In terms of when new projects would start, if they are funded. So for new projects, again, these are projects that don't currently receive CoC funding. If HUD funds them, typically they would likely start operations, meaning you have your grant agreement from HUD, the funding is available the latter part of 2025. So really over a year from now. That's typically, that's the timeline that we see. If you are applying for expansion funding, and if that funding is awarded, this project start date will be the same as your existing project start date. So whatever your existing project is, if it has a July 1st start date, and if you are awarded funding, this new funding will be available July 1st, 2025. Because again, the HUD would just issue one grant agreement for all of that funding together. So one thing that's a little bit new this year is applying for a supportive services budget line for permanent supportive housing, rapid rehousing, and our joint component project types. So PSH, RRH, and the joint component project types may submit an application requesting funding for services only, without also having to include in that application funding for additional units. This applies to both new or expansion projects. It would apply to both CoC bonus or the DV bonus projects. This is a new item that we're incorporating this year for rapid rehousing and the THRRH project types. For the past two competitions, PSH projects have had this ability to request just additional service funding without also requesting additional units. So this year we're expanding that allowance to all of the housing type projects, essentially, both rapid rehousing and the joint component THRRH project types. And so that was that decision was made and is being implemented in response to what we've been hearing from providers in terms of the need for additional services funding, the need for additional services capacity to better serve the people who are being referred to their projects. So we wanted to make that opportunity available, not just to the permanent supportive housing projects, but to other housing projects as well. All right. In the application, there's going to be a couple of questions regarding leveraging housing and healthcare resources. So I want to take a moment to talk about what this is. And in the application, you'll also see that if you have documentation, you are asked to upload it and submit it. So there are questions in the application that ask about the extent to which the project that you're applying for is able to leverage or bring to the project healthcare resources and non-CoC housing resources. And then again, documentation, if you do have documentation. This does not apply to our coordinated entry grant. I'll just say that it applies just to the housing applications. So the goal for why we incorporate this in the applications is to identify how these projects, how our new projects are leveraging or again, kind of bringing into their project these other sources of funding, whether it's healthcare resources or housing resources, to, and again, improve and expand the ability of these healthcare and housing for people in these projects. This is also tied to a scored criteria in the overall CoC application. Excuse me. In the overall CoC application, which we're not really talking about here today, but just as this kind of a side note, we have to indicate to HUD the percentage of what is being leveraged with our new project applications for healthcare and housing resources. HUD then scores us on that. And the more that we're able to demonstrate, the higher our score. The higher our score, the more likely we are to get new funding from HUD. So because of that, we've implemented this leveraging question in our local application process as well. Now, if you as an applicant are not able to identify any healthcare or housing leveraging, we will absolutely still review your application. That doesn't mean that you can't submit an application or you won't be reviewed. This is just one element of what you're going to find in the application, and it's one of the evaluation criteria. So what do we mean when we say non-CoC housing resources? So this would include subsidies or subsidized units that are funded by any of the following: any private organizations, state or local government, public housing agencies, any faith-based organizations, or any other federal programs besides CoC or ESG. ESG's Emergency Solutions Grant. So maybe just as an example of what we have seen in the past, when we have had projects that have applied for new funding, and perhaps it's for a PSH project that has project-based vouchers attached to it. Those vouchers are not funded with CoC dollars, they're funded through a public housing agency. Their ability to document that and provide, evidence that, hey, these services would be within this building that have project-based vouchers attached to it. That would be an example of leveraging other non-CoC housing resources. Examples of leveraging healthcare resources include any direct contributions from private or public health insurance, including Medicaid services that can be billed for, or any healthcare services provided by a private or public organization. I realize this may not be a lot of detailed information that you may be looking for in terms of what counts as leveraging. This is the best that we are able to communicate at this time in terms of what HUD looks for in terms of leveraging housing or healthcare resources. If you have additional questions, feel free to bring them up, drop them in the chat, or reach out to me afterwards. Okay. I'm going to pause for just a moment to see if there are any questions. I don't see anything in the chat, but I will just pause to see if anyone has any questions right now that I can answer.
The housing leveraging component, does that need to be current, or can it be something that is going to happen in the future?
So ideally, I think we would like it to be something that is current. That you can demonstrate that you have this now, or if you can demonstrate this is something that maybe we don't have it right now, but we know it's going to be available starting next year on this date, that would be acceptable too. And there in the application, there's a place where you can, in the question where you can explain that.
Thank you.
You bet. Okay, a couple of other questions. So question, the sources of healthcare match, I think maybe Lindy meant in terms of healthcare leveraging. So I have this on the slide here. This is, I'm sort of sharing what HUD has indicated that they would accept. And the reason why I'm deferring back to HUD is, again, because we're trying to tie that element in the CoC application that HUD scores us on with this element here. So this is kind of what HUD says would be acceptable. Again, it's a little broad, a little vague, but health and any health insurance reimbursements, whether that's private health insurance or Medicaid, or healthcare services provided by a private or public organization. I think maybe another example could be perhaps you are connected with a federally qualified health center, FQHC. You have an agreement where your individual, the people that you're serving, can access their healthcare resources. You would need to add, kind of put a dollar amount to that. That's similar to how you would document in-kind match. But I think that could be another example of leveraging healthcare resources. Okay, and there's a few more questions in the chat. One question is if an organization has to be a Detroit-based nonprofit. I'll get to some eligibility criteria in order to apply in a minute, so I'm going to kind of pause on that question. The estimated amount of funding. So the amount of funding we have is just an estimate at this point. For the CoC bonus funding, we anticipate having between $1.5 to $2 million available. And then for domestic violence bonus funding, we anticipate having between $2.5 and $3 million available. Again, based on our best estimate at this point. So Linda, again, to your question, if you're working with a partner organization who provides healthcare to your clients, I would say yes, that is something you could, again, you would have to be able to document it, have to be able to attach a value to it. So a dollar amount, like what is this healthcare service that they're providing? What is that worth? But if you can document that, like that could be considered as healthcare leveraging. And again, Linda, for your final question, I think, yeah, something if you anticipate, I think that's similar to Jean's question. If it's not a source that you have available right now, June 2024, but you anticipate it will be available come next fall, we will accept that. And you can, again, just explain that in the application question itself. Okay. All right, great questions. Okay, so I'm going to go on to this next piece here. So we're going to run through a little bit these new project priorities. We're going to run through this both for our CoC bonus funding and then the domestic violence bonus funding. And so kind of let's give some kind of context or background to this. So once we receive all of the applications and they are reviewed and we've determined of the applications that we receive, these are the ones that we want to submit to HUD for funding. It may be all of them, it may be a part of them. It's all going to depend on the results of the review process. At that point, because we're going to have a pool of applications that we want to see funded, but we're going to have a limited pool of funding to give to those applications. It's unlikely that we're going to have sufficient funding to fund all of the applications that we're going to receive, particularly with our CoC bonus dollars. So we've come up with some priorities in the order in which, once we know which projects we want to have funded, we're going to allocate funding to those projects based on these following priorities. And we're going to go down this priority list essentially until we run out of funding to allocate to these projects. So the first priority of the project type, this is again with our CoC bonus, that we would allocate funding to would be those new or expansion projects that are going to bring on additional units with a goal of at least 30 additional units. I'm going to talk a bit more about these goal numbers too. With all of these priorities, I should say as well, the overall score that the application receives will come into play as well. So once we make those allocations to PSH projects that would result in additional units, if we have funding remaining to allocate, then we would fund new or expansion rapid rehousing projects that are going to bring on additional units, again, with a goal of at least 20 units. So the kind of these first two priorities, we're really trying to drill down to the fact that we know we need additional PSH, additional rapid rehousing units in the CoC to better serve people. So we're really wanting to prioritize allocating funding to those project types that are going to result in additional units. Projects, so a PSH project that is applying for more than 30 units, or a rapid rehousing project that's applying for more than 30 units, may still be submitted to HUD for that full number of units. It's really going to depend on the quality of the application. It also, if as an applicant you feel like you can best fund an additional 10 units or a lesser number of these units, that will still certainly be considered. I don't want to make it sound like if you're applying for additional units for PSH or rapid, you have to only apply for 30 or you have to only apply for 20. That's not what this means. We put these goal numbers in place just to have some rough boundaries in terms of when we will then move to the next allocation priority. But as we are making these decisions within the project review committee and within the board, we'll take into consideration a number of factors, one being really the quality of the application itself. All right, so kind of our third allocation priority, once we funded any new rapid rehousing projects that would provide additional units, then we were kind of switching back to PSH and funding any new PSH projects that are requesting just services only funding. Then if we have funding that is remaining, we would move to rapid rehousing projects that are requesting services only funding. Then as funds remain, if at this point we have any remaining permanent supportive housing or rapid rehousing projects that are not already otherwise given an allocation, we would fund them. And then lastly, we would fund any expansion coordinated entry projects. So this is, again, just sort of the order in which those funds would be allocated. It may be possible that we would, if we don't get any rapid rehousing projects requesting services only funding, no one applies for that, then we would obviously skip from third to fifth. So it's all going to depend as well on what agencies apply for. So The same process will then take place for the domestic violence bonus funding. There's fewer project types that we can fund with these DV dollars, so this is going to be a little bit more simple. But the first allocation priority will be those rapid rehousing or joint component project types that would result in additional units. Then the second allocation priority would be either rapid rehousing or joint component project types that are requesting services only funding. And then lastly, any new or expansion coordinated entry grants. So similar to what we saw on the CoC side, just different, fewer project types. So we are gonna, Linda, I see your question, and we'll get to the coordinated entry SSO in a little bit. We'll describe that in a moment. And the question about, do units have to be in individual buildings? So, Jill, to your question, I think if you're talking about a project-based or site-based permanent supportive housing project, essentially, yes, those units are all, we typically see they're all in one building. Sometimes it could be one or two buildings, but essentially the unit in the building is the project, I guess you could say, versus a scattered site where an individual could identify really kind of any unit in the CoC. So I'm not sure if I'm fully answering that question. So if you want to clarify, you can drop it in the chat or come off mute. Okay, I'm going to talk a bit about target populations of who can you serve in these projects. I realize there's a lot of text on this screen. This is kind of dense. Again, this is all detailed out in the RFP as well. So permanent supportive housing are PSH projects, whether you're applying for new or expansion funding, do need to be what is called a dedicated plus project. We'll give the definition of dedicated plus in a moment. This essentially dedicated plus is about 6 different criteria that people could meet in order to be served in that PSH project. It includes people who are experiencing chronic homelessness. But there are questions in the application that talk about target population, and there again is language in the RFP that all PSH projects do need to be what's considered dedicated plus. All of our current CoC PSH projects are dedicated plus as well. And so this is to help continue that consistency. PSH projects can be targeted to either single individuals or families or a combination thereof. That will depend on the project type that you're developing. One thing to note is that we will not consider PSH projects that are exclusively targeted to youth. That's defined as people who are aged 18 to 24. People who are 18 to 24 may be otherwise served in our PSH projects. We are just not going to consider new projects that are exclusively targeted to that age group because there are other resources available for them. So for rapid, and I'm just going to kind of quickly just kind of continue to tick through this. So rapid rehousing does need to serve people who are either category 1 or category 4 homeless. Those definitions are given in the RFP as well. Again, they can serve either individuals or families or a combination thereof. But likewise, we would not consider rapid rehousing that are exclusively targeted to people 18 to 24. Similarly, with the joint component THRRH, you can see a theme here. We're not going to consider projects exclusively targeted to youth. And again, I'm saying all this because we do have other projects that are targeted to that population through our YHDP funding and through some other existing CoC resources. So in order to create more housing opportunities for people that are not 18 to 24, that's why we're saying we're not going to consider new CoC projects exclusively targeted to that age range. Rapid rehousing and joint component project types that are applying for domestic violence bonus funding must serve people who are fleeing or attempting to flee domestic violence. So that is that category 4 homeless definition. That is who HUD requires those project types serve. Coordinated entry, supportive services only projects, those that are applying for CoC bonus do need to serve anyone that's accessing the coordinated entry system. So it's quite broad. The DV bonus coordinated entry projects are limited to serving people who are fleeing domestic violence. And I'm seeing it's a question about the definition of domestic violence. I will get to that as well. And I will also touch on how people who are fleeing human trafficking can be considered in there as well. Okay, backing up a minute. We talked about dedicated plus. I'm not going to read through all this because it's too detailed. This is given in the RFP. But as I said, permanent supportive housing projects do need to be what's called a dedicated plus. So these are the categories or the eligibility criteria of people who would then be referred to that dedicated plus project. But what's important to note is that people who are experiencing chronic homelessness are included in this dedicated plus definition. Likewise, people are going to be referred to your PSH project in accordance with our local prioritization policies through coordinated entry. And those current policies do state that people who are experiencing chronic homelessness are essentially at the top of the priority list to be referred to PSH. So therefore, if you are applying for new PSH funding, you can anticipate that the individuals, the families, the households who will be referred to you will be experiencing chronic homelessness. Again, there's a lot of other kind of categories and details here, which I'm not going to take the time to go over. You can, again, read this in the RFP. If there's any other pressing questions on that, I will can circle back to that. So eligibility criteria, who can apply for these funds? And I think this was a question in the chat as well. So HUD has 3 main eligibility criteria that an entity needs to meet in order to be eligible to apply. You need to be a nonprofit organization, which means you have your 501c3 status, or a state or local government, or a public housing agency. The vast majority of entities that receive CoC funding in Detroit are nonprofit organizations, but those are the criteria that HUD stipulates. I think one of the questions was also asking if your nonprofit had to be like physically located in the city of Detroit or our Detroit jurisdiction, which is Detroit, Hamtramck, and Highland Park. And to that, I would say no. You do need to be providing those services in the Detroit CoC. Your referrals are going to come from the Detroit CoC. Services need to happen within the Detroit jurisdiction. But if your agency itself is perhaps located outside of the Detroit CoC, we will still consider your application. Granted, if you are located outside of the Detroit CoC, in the application materials, we're going to want to know what is your experience providing these services in Detroit, what is your familiarity with Detroit. So those questions will come through in the application, but you are still eligible to apply. So that's HUD's criteria. A couple of things I do want to note, which I touched on as well. For agencies applying for CoC bonus for the coordinated entry grant, those applications are limited to the current CoC coordinated entry direct recipients, which right now is Community and Home Supports and HAND. HAND was selected as the new coordinated entry lead agency last year. So HAND and CHS are the 2 entities that are currently direct recipients of coordinated entry funding, and they are the only 2 eligible applicants to apply for those dollars. On the domestic violence bonus side for coordinated entry grants, eligible applicants are, that's the broader list. So as long as you're a nonprofit, state or local government, or a public housing agency, you would be eligible to apply. So if there's any other questions on if you're eligible to apply, let me know and drop it in the chat. Okay. So referrals and coordinated entry. So any project that receives CoC funding is required to receive their referrals through our coordinated entry system, or CAM. So this is obviously going to apply to permanent supportive housing, rapid rehousing, the joint component project types, whether the project is funded with CoC bonus or domestic violence bonus. Any units or housing services that are provided by these projects can only serve people who are referred to them through our coordinated entry system. This is a HUD requirement. This is a local CoC requirement. So this is what needs to happen. So I referenced this a little bit earlier. We do have referral prioritization priorities that will dictate, who is referred to your project. Again, really the intent with coordinated entry is to ensure that we are referring people with the highest needs to these projects to make sure that we are appropriately meeting their needs. If your agency is new to coordinated entry in Detroit, and if your project is selected for funding, we will have more conversations with you, more additional training or orientation to how coordinated entry in Detroit works and what that means for your project. All right, there's some questions in the chat, so let me pause for a moment. So, all right, so looking at Jamie's question, if you're building a LIHTC development, we have 60 units, but during the application, you stated that 30 would be set aside for experiencing chronic homelessness. What tier would that project be placed in when scored? So again, going back to those orders of priority, if think of through like if this project was funded, it would bring on 30 additional units of permanent supportive housing. So it would be within that kind of first tier of funding allocation priorities. And then Linda, your question, so there's no new SSO for existing PSH projects. So just to clarify, if you are an existing PSH project and you want to apply for more supportive services funding for your project, you may do so, but you're submitting a PSH application. You're not submitting a coordinated entry SSO application. The application it's a PSH application because it's funding for a PSH project. And so it's going to need to meet all of those PSH project requirements. But within that application, you're only requesting a supportive services budget line. So it's still PSH, but a supportive services budget line. And then your other question, can an expansion request for our current PSH to another site in a building co-located with a shelter be eligible? You can certainly submit that in the application. There will be questions in the application where you do need to describe the space, the location. And so that's where you would describe that. And then just that would be taken into consideration during the review process. And then Jamie, your question, clarification, if the units are already set aside for chronics. Oh, I'm sorry. I see what your question prior to HUD getting funding. I'm sorry. I misunderstood your first question. So in the example that you're giving, if I'm interpreting it correctly, even if the project was not going to receive CoC funding, it sounds like those units would come online anyway, even if they did not receive the additional CoC dollars. In that case, then they would be in that lower priority kind of tier, because we think of it in terms of, would these units come into existence anyway, even without CoC funding? Or is the CoC funding necessary in order for these units to be realized? So that's kind of the distinction that we make there. So I'm backtracking on what I said earlier, because if those units would already come online, even if they did not receive CoC funding, then they are going to be in one of those lower prioritization tiers of getting an allocation. That certainly doesn't mean that they're out of the running at all. All of it is also going to depend on the overall, what projects are received for our review, but just to clarify that. Okay, I want to run through now some general requirements for all of our project types. Then we'll talk a little bit about some general requirements for specific project types. So again, there's in the RFP materials, there are links to a lot of additional resources where you can learn more about what these terms mean, what these requirements mean. So if any of this is unfamiliar to you, just please review the application materials. So all projects are expected to adhere to housing first, essentially meaning that people are placed into housing and maintained in their housing without a requirement that they go through a series of services first, or that they have to engage in services in order to maintain their housing eligibility. There's different CoC written standards, policies, and procedures that projects are expected to comply with. Again, these are linked in the RFP. There's a lot of HUD requirements. I did call out in particular the 25% match requirement. That is just one of the HUD requirements. These are federal funds, so they come with a lot of regulations that agencies do need to be compliant with. Compliance with HMIS, as I referenced earlier. We do ask, and we're going to look for in the application materials, the project's ability to enroll the participant within 3 months of receiving your grant agreement. If there's rehab that needs to be done on the building, then we would expect that you're able to enroll the first person within 3 months of that rehab being completed. As a side note, you're not able to apply for CoC funding for rehab or in those hard costs. You would need to have that funding come from elsewhere. But if there is rehab work that needs to be done on that building, we would expect once that's completed, you're able to enroll your first participant within 3 months. The whole point of this is that once you get that grant agreement, we want to see services and housing happen as expediently as possible. There's environmental review requirements that do need to be met. So this is a bit of there's a lot there to the environmental reviews. I do work with agencies and the city of Detroit to get those environmental reviews done. So I do link to that in the application materials as well. But just know that that is a piece of the work that will need to be done. And then there are assessment fees. So agencies that receive CoC funding in Detroit are charged a small assessment fee. This helps to support the work of the continuum. Details, again, are given in the RFP. So if you are funded, just note that there will be that small assessment fee levied. All right, I'm going to go to some additional requirements for specific project types. So for permanent supportive housing, this is much of this is what we have had in years past. So for PSH, we are not going to consider applications for SROs or single room occupancy projects. This has been consistent for a number of years. And we do that simply because based on what we hear from clients who are coming through coordinated entry, they prefer non-SROs, a studio apartment or 1-bedroom apartment. And so because of that, we want to align how we're using our resources with what we understand people who are experiencing homelessness prefer. So we're not going to consider PSH projects, either new or expansion for SROs. Talked about some of this before. The third point there, all projects may only request a 1-year budget. You're going to see that in the budget forms. When you put your budget request in, it's for 1 year. After that initial 1-year grant term, the project would be eligible for renewal in subsequent 1-year cycles, dependent on project performance, project funding availability, all of those details. But just know that after that first year, for the most part, again, barring anything significant, that project, you would be eligible for subsequent 1-year renewals after that. So if you're applying for a scattered site PSH project, you do need to provide scattered site leasing or rental assistance. One thing to note here, that assistance could be provided through another source. If you're just requesting services funding to go with that other rental assistance, that is allowable. If you are applying for a project-based project, we do need to see in the application that you have either a deed or a long-term lease agreement, something that demonstrates that you have site control over this building, this site that you are proposing to operate the permanent supportive housing out of. So that is an important piece of it. You can't just apply and say, I saw this building down the street, I thought it looked great, I'm going to try to do something there. You need to be able to demonstrate that you have site control of the property. While we're on the topic of project-based permanent supportive housing, if you are a PSH project, a project-based, and you are applying for or you have applied for low-income housing tax credits through MSHDA, there's going to be questions in the application specific to those tax credits. So it's going to ask if you've applied, when you plan on applying, if you're applying for 4% or 9%, kind of where you are in that process. Understanding of where a project is in that application process is really important for us during the review to make sure that the timing of everything is going to align. So that if you are applying for those tax credits, you're going to see that question there. If you are unfamiliar with what tax credits are or how to apply for them, that is a whole separate conversation. Really, if you're applying, if you see those questions in the application and they are relevant to you and your project, you'll know that. You'll also don't be surprised by that as well. One thing to keep in mind that when agencies apply for permanent supportive housing tax credits through MSHDA, they have to come to the CoC to get a letter of support, which is again a totally different process. If this applies to you, you have probably already gotten that letter of support some time ago. But I just wanted to point out that because that information is known to hand and it will be known to our reviewers, we're going to be taking a review and taking a look at what you're submitting in your project application for the CoC funding and comparing that to what the application looked like when you applied for that letter of support to ensure alignment with target population, the building is the same, to make sure that there's some consistencies there. If there are any inconsistencies, that will be taken into consideration during the review process and may need some follow-up conversations. One of the biggest places we've seen inconsistencies in the past is with target populations between who, was said in the LIHTC application would be targeted, then there was a difference in the target population for the CoC application. Those target populations need to be the same. So just keep that in mind if this LIHTC piece applies to you. Some additional requirements for rapid rehousing projects. So rapid rehousing projects are limited to providing what's called tenant-based rental assistance. That means that essentially the rental assistance goes with the tenant. If they need to, while they're still enrolled with the program, need to move to a different unit, they can do so and still retain that rental assistance. Some of this I've already, talked about. The point number 4, I do want to mention there's a regulatory requirement for rapid rehousing projects that people must receive at least monthly case management. So even though we talk about housing first and services being optional, there is that monthly case management requirement. And again, just a 1-year budget can be requested. Additional requirements for joint component projects is very similar with the rapid rehousing grants. Again, the noting though, we are only funding these joint component projects for people who are fleeing or attempting to flee domestic violence. So that does need to be the target population. The application does need to be able to demonstrate an ability to provide both transitional housing and rapid rehousing. Now that can be done if there's a sub-recipient relationship in the application, or a project partner is maybe providing one part of that service, the other project partner is providing the other part of that service. That is something that you could apply for. You would just certainly need to describe that in the application. Also to note is that when we talk about the number of units or the number of beds that are provided, there must be twice as much rapid rehousing as there is transitional housing. This is something that HUD requires. They really want to see more rapid rehousing than there is transitional housing. So just maybe a simple example, if you are applying for this project and say you have a 10-unit transitional housing building, where that would be the transitional housing part of it, then you need to be providing at least 20 units of rapid rehousing. There has to be that 2-to-1 ratio between rapid rehousing and transitional housing. The rapid rehousing case management requirements still apply, and again, the 1-year budget applies. All right, coordinated entry grants. Coordinated entry grants, in terms of the types of activities that can be applied for, they are limited. These are given in great detail in the RFP, so I'm not going to go over all this detail here. You'll have to review the RFP, but we'll consider activities that are access point activities or navigation activities. Those are the 2 main types of activities that we'll consider. We do have this caveat, this kind of other activities. This is a little bit broader. If you are applying for coordinated entry activities that are not access point or navigation, you would need to demonstrate in the application what these other activities are and how they meet a need within the coordinated entry system. And then, the extent to which you're able to demonstrate that need will be taken into consideration during the review process. Again, there's a lot of detail in the RFP on what we mean by access point and navigation, so please review that information there. So coordinated entry grants also do need to have a letter of support from the CAM governance committee. So in the RFP, that process is detailed in terms of how you request that letter of support. You first need to send something to me. I think it's by July 8th. I don't have the date right in front of me. I'll show this to you when we click over to our website as well. There's a simple form that needs to be filled that's submitted to me. I then submit it to the CAM governance committee. They will review it. If they support it, they will sign it, and you will get it back to you by July 29th, well ahead of that, so you can upload it in the application portal. The reason why we required this CAM governance letter of support is so that we don't end up perhaps funding a new coordinated entry grant, and then if it's funded, it comes to fruition in our CAM governance committee, which oversees coordinated entry, is caught off guard or surprised, like, what is this project? Who is this agency? So it's a way for us to ensure that whatever is being proposed aligns with kind of the needs of the CAM system. Okay, so I think this is a question that was in the chat about target population for the domestic violence project. So the target population for the domestic violence bonus projects are people that meet that category 4 definition of within HUD's homeless definition. And broadly speaking, that means that someone who is fleeing or attempting to flee domestic violence. HUD gives a lot of, again, more details in terms of what that actually means. But essentially, it's a violence that has taken place within their primary nighttime residence. They are unable to return or stay there, and they have no other support networks. So it's a little bit different than the literal homeless definition. When you maybe think of someone who's staying unsheltered or staying on in an emergency shelter. The category 4 definition, again, is a little bit different and really points to someone who is unable to return to or stay in their primary nighttime residence because of the domestic violence that is occurring within that residence. For the purposes of this application, HUD has also clarified that they consider people who are fleeing or attempting to flee human trafficking as falling within that category 4 umbrella, I guess you could say, because they consider someone who is fleeing or attempting to flee human trafficking as being in a situation where their personal safety is at risk. I'm not using the same words that HUD is, so I apologize. The one thing to note is that if you are applying for the DV bonus funding, while you may serve people who are fleeing or attempting to flee human trafficking, you cannot exclusively target your project to that population or exclusively serve that population. So again, the individuals who are, again, fleeing or attempting to flee human trafficking are eligible. You just cannot exclusively target your project to that population. I want to go back because I think Jean asked that question. So the question, I think, Jean, you also asked, does this include those experiencing, so you also asked about sexual assault. So I would say yes. I've not seen anything in HUD's language that would exclude people experiencing sexual assault. And again, that category 4 homeless definition is given in detail in the application materials.
Amanda, I think the one good thing that you did mention was that the victims did not have to be literally homeless. They could be attempting to flee.
Correct. That's correct. Yep. Right. So you could have someone who perhaps they have a lease in their own name, or they have a housing, but because of the nature of what is occurring within that unit, it is not safe for them to continue to reside there. Yeah. Okay, there was another question, backing up a little bit. So Linda, your question, if your current PSH project is not dedicated plus, are we not eligible for new PSH funds? So if you're talking about a currently existing Detroit CoC PSH project, it is dedicated plus. All of our current CoC PSH projects are dedicated plus. So to clarify that, if you have an existing PSH project, I guess that is not CoC funded, that is not dedicated plus, that doesn't necessarily mean you're not eligible to apply, but that portion that would receive the CoC funding would need to serve the dedicated plus. Okay, you got it. And then in terms of the factors required for coordinated entry eligibility, so if you're talking about applicants, eligible applicants, like what agencies may apply for coordinated entry funding, for the CoC bonus funding, eligible applicants are limited to our current coordinated entry recipients, which is HAND as the CAM lead agency and Community and Home Supports as one of the implementing partners. For the domestic violence bonus coordinated entry funding, nonprofit, any of HUD's eligible applicants. So a nonprofit organization is eligible to apply. Okay, I want to touch on just a couple of other things that have come up in the past, some other questions. One is regarding renting units outside of the CoC jurisdiction. So the Detroit CoC jurisdiction is Detroit, Hamtramck, and Highland Park. Highland Park and Hamtramck are part of our jurisdiction. So projects that are funded with tenant-based rental assistance or TBRA, this is going to include all rapid rehousing and a PSH. I think we left off talking about renting units outside of the CoC jurisdiction. That is allowable in limited instances, and it depends on if you have tenant-based rental assistance, you can rent up to half of your units outside of the CoC jurisdiction. Again, there's more details in the RFP, so please refer to that. Otherwise, just keep in mind that the expectation is that the majority of the units and the housing and then the services, everything is provided within the Detroit CoC boundaries. HMIS is required for all projects. If you are applying for domestic violence bonus funding, there will be questions in the application that are going to ask if you need to use a comparable database. There's a flow tree that will help you walk through that decision-making process. If you do need to use a comparable database, then there are subsequent questions that will ask you about that database. So just be mindful of this, that all projects that receive CoC funding do need to use either HMIS or a comparable database. So again, you will see questions in the application that you'll need to respond to accordingly. If you are ultimately funded, you'll get a lot more attention from HAND in terms of on the HMIS side, in terms of ramping up onboarding, training, all of that good stuff. I kind of already touched on this. Okay, I'm gonna click through all of these performance expectations, everything that we're going to be looking at within projects that are funded. Please review that so you know if you are funded, what we're going to be looking at in terms of project performance for continued funding. The CAM governance letter of support, I touched on this. If you are applying for coordinated entry funding, either CoC bonus or domestic violence bonus, you do need to request that the CAM governance letter of support. There's a template that you have to use that is on HAND's website. You need to get that template completed to me by July 8th. I will then manage the process of getting it from the CAM governance committee. If they approve it, you will get that signed letter by July 23rd that you then need to upload into the online portal. So this only applies if you're going to be applying for coordinated entry funding. You do need that CAM governance letter of support. Okay. Yeah. So applications are due again on July 22nd. July 29th. I keep saying July 22nd. July 29th needs to go with what is written. July 29th at noon. Please be sure that your applications are submitted by then. I do want to switch over to show you the online portal and the website where you can find everything that I went over today, in case we get kicked off again. So the website that I put in the chat, this is HAND's website. Everything that I went over today is posted here. Again, the recording, the slides from today will be posted here. The actual RFP, hopefully you've had a chance to read through it by now. It's really important that you read that closely, especially because this webinar is not going into all of the fine details that will be important for you to know. The budget spreadsheets that you will need to download, complete, and upload into the portal are also accessed here. I'm going to be going over those spreadsheets in a moment, but just know that this is where you're going to get those blank spreadsheets, blank budgets for you to fill out. The CAM Governance Committee, the letter of support template. Again, that is accessed here. You're going to download it, complete it, send it to me by July 8th. What I also have posted here is linked here. It says applicant agencies may view the questions that you will encounter in the online portal. So that is linked here. This is a very lengthy document, but it gives the text of the questions that you're going to see in the online portal. And this document was provided just to give you a sense of, especially if you have maybe some colleagues that you might be working on with this application for, so that you know what are the questions you're going to see so you can start preparing your responses. Your application must still be submitted through the online portal. So don't take this PDF document and write your answers to it and submit it to me that way. Your application will not be considered. These questions are only given so that you know what to anticipate once you get into the online portal. All right, so let's talk about the online portal. The link to it is here. It says web portal, yada, yada, yada. So I'm going to kind of do some walking through of what to expect when you get to this online portal. Hopefully it's a pretty user-friendly system. We used it last year and it worked. So when you first click on the link to the online portal, you're going to get this sign-in page. If you, like every other online system, if you have not made an account, you're going to need to make an account. I will note that one of the limitations with this portal is that you can really only have one person accessing it at a time. This is not the kind of online portal where you could have, more than one person from your agency logging in and working on the same application at once. So that is one of the limitations. Okay, I'm going to just kind of walk through what it looks like. I'm going to log in with my username and password. So the first thing that you're going to do, I've already done this, but the first thing you're going to do upon logging in is you will need to create a profile. This is a very simple form. It asks for very basic information about your organization. It's largely contact information, really. It will ask at the end what type of organization you are. It also asks if you have an active SAM registration and a current unique entity identifier. This is necessary to apply for federal funding. If you can answer this anyway, yes, no, or unsure. Your answer here will not disqualify you from applying. We will just need to know this so that we can plan accordingly if your application is selected. So this is really just so that we know where you are in that process. So you're going to fill out that application profile. You can go back and edit it if you need to, update contact information, all of that. Once you've completed the profile, you're then going to select the add another. You can see here on this example, I've kind of started a couple of applications just to show you what they look like. If you have not started one, you're not going to see these two kind of tiles. You'll just see the add another. So you're going to click on that, and then the application form will open up. I'm sorry, application intake. So then you do need to click open. One more step there. So the first few questions are pretty basic. It's, agency name, project name, contact information, pretty straightforward. The couple of things that I want to point out, kind of this paragraph here. So as you go through the application and are completing the questions, the numbers are not going to be numbered sequentially. And that's because there is skip logic built into the application where only certain questions are going to appear based on how you answered prior questions. So when you go through the application, you're going to see it might skip like from question 9 and then skip to question 18. And that's okay. Again, that you see some of those questions skipped because of the skip logic built into it. But in order for the skip logic to work appropriately, it is really important that these first few questions be answered accurately. So, because a lot of the skip logic is going to depend on the type of application you're applying for, the type of project, and if it's a new or expansion project. So the first thing that you want to be sure to answer correctly is whether you're applying for CoC bonus or domestic violence bonus. So you're going to select one of those two. Then you're going to select which type of project you're applying for. So if you're applying for permanent supportive housing, you want to be sure that you select either scattered site or project-based, because depending on which two of those questions you answer, or which two of those you select, will depend on the questions that are opened up later on. Let me just do an example here too, that applies to the joint component project type. If you are applying for the joint component project type, again, the THRRH project type, it is then going to ask you if the TH portion is scattered site or project-based. So again, you're going to need to answer that appropriately, because that will determine the following questions that will show up throughout the application. So you're going to choose one of those as appropriate. Then you're going to be asked a question of whether this is a new project or an expansion project. If it's expansion, it's going to ask you for information about the grant that you're expanding. So the grant number and the project name. The last kind of top of the application question you need to answer is whether or not this project will have a subrecipient. If you answer yes, there's additional information that will need to be filled out regarding information about the subrecipient, who they are. And then as you scroll down, there's going to be a section where you will have to enter the amount of your budget that will be given to the subrecipient. If you do not have a subrecipient on your project, then you're just going to answer no, and those subrecipient questions will go away. So those first few questions there, again, are really important that they be answered accurately. If you don't answer them accurately, it really could impact the review of your project and whether or not your project is selected for funding. All right, I'm going to go back and show a couple of the ones that I've made some more progress on. At any point, you can go back to the home page, and that will take you back to the different applications that you've started. So once you have this example, I have completed the application, I've gone through all of the questions, I've submitted it, and I can see that there's this green button that says this has been submitted. So now on my end of this application portal, I can see that this application has been submitted. So at this point, you can view the application, you can open it up and view, you can see I've just, answered this, didn't really answer the questions, but I had to put something there. You'd be able to see the responses that you gave, but you can't edit anything anymore. It's view only access. So that's once you have submitted it. I go back to this other example that I was working on. You can at any point save your work and close out of this portal, come back to it and continue the work. So for this example, I started working on this application, but I didn't finish it. So I can go back to, kind of wherever I left off, go back and make some edits, make any changes that I want to the application. I'm not going to be going over all of the individual questions in the application, just again, in the interest of time and because there's a lot here. You will notice that most of the applications are required, an answer is required. So this is pretty typical, I'm sure, with online forms, it won't let you submit it without providing a response. If I scroll down to the end and, if I mark complete, or if I try to submit it, and I'm going to get all these warnings that these questions are required. So there's a safety built in there that it won't let you submit something until everything is completed. You can always, again, save it as a draft. I think the system does automatically, save periodically as well, but just to be safe, save it as a draft. And then you can always close out, log out of the system and come back in and continue working on it. But again, once you have completed everything, you're gonna, all your questions are answered, you're gonna click the mark complete. You will then get a, on this page, this button that says submit will turn green. Once you've completed everything and answered all of the questions, you must hit this green submit button in order for the application to actually be submitted. Okay, there's a couple of questions in the chat. Linda, I said, if you're a current PSH provider and you want to provide more supportive services, is it the CESSO you apply for? And no, you're going to apply for permanent supportive housing. But in your application, you're only going to request the supportive services budget line. And I'll show that when I pull up the application budgets. So again, if you are current PSH project and you want additional services funding for that PSH project, you must submit a PSH application. And then Jean, if you had a profile from last year, you might need to update it. So I believe so that's a great question. So some of you on this call may have applied last year. If you have a profile from last year, you should be able to still use that same login information. Obviously, if anything in your profile, like contact information or address changed, you can edit it that way. But if you have your login information from last year, you should be able to use that information to log in. Worst case scenario, if you don't have your login information from last year, you can, kind of at the very beginning when it says, are you a new user, you can kind of start over from scratch. That would work too. Okay. Any questions with the online portal? Okay, not seeing any. So I want to talk a minute about the budget spreadsheets that you're gonna be required. Is there a helpline for the portal? I am the helpline for the portal. So lucky you. You can reach out to me if you have challenges. And if the question is something that I can't resolve, I can run it up the chain to some other folks, but you start with me. Yeah. Let me open up an example of an application. I've referenced this before about the budget spreadsheet that you're going to need to upload. So I'm going to scroll, sorry, making you dizzy, scrolling to the end of the application. This section is all of the attachments. So most of these attachments are not going to have that red asterisk they're required next to them. There's two exceptions. A required attachment 1, if you are applying for coordinated entry funding, you must upload that CAM governance committee letter of support. And you must upload your budget spreadsheet. So those are the only two attachments that are going to be flagged if you don't upload them. Other attachments are essentially optional in terms of the application will let you submit it even if you don't upload anything. The process for uploading attachments is pretty straightforward. I think we've all done this kind of thing in the past. You click select a file, find where the attachment is on your computer, upload it, and save it. But you will see here, the budget spreadsheet that needs to be uploaded, and it links you back to Han's website on where you find that budget spreadsheet. So if we go back to Han's website, sorry, you're going to see these budget spreadsheets here. There's two different types of spreadsheets, so be sure to select the correct one depending on the type of project that you're applying for. If you're applying for permanent supportive housing, you're going to select the PSH one, obviously. All other projects are going to select the other spreadsheet. Our PSH projects, those budget spreadsheets ask for a lot more detailed information. So that's why there is a separate, different spreadsheet. So I'm going to start with the more simple spreadsheet. So this is the spreadsheet you would use if you're applying for rapid rehousing, the joint component project type, or coordinated entry, whether CoC bonus or domestic violence bonus. This is the spreadsheet you're going to use. The first tab is just instructions, so pretty straightforward. You can read through those instructions. They will tell you how to fill out the subsequent tabs. Tab B is where you're going to actually put your request. So this is a sample that we're looking at that I have filled out. So just going to kind of quickly walk through this. So in this example, I should have also said, any cell that's this orange color is going to automatically populate. And so there's formulas built in there. So the only thing that you're going to need to fill out are the blue cells. That's where you're going to enter the dollar amount that you're requesting or any narrative regarding what you're requesting. So in this example, this is a rapid rehousing application. I'm filling out the rental assistance budget. I've indicated that I want to do 25 units. So I've given the number and size of the units. This is going to automatically calculate based on the current FMR rates what that request is. It comes out and calculates it for a 1-year budget. This comes out to about $354,000. You'll see this amount is then carried over into this summary budget at the top. So as you complete the detailed budgets lower down, it carries over to the summary budget at the top. So going on through, because this is rapid rehousing, I'm not requesting leasing assistance. This would be you're leasing individual units, which you can't do for rapid rehousing. I'm also not requesting any leasing for a structure. This would be allowable if you were leasing a building, maybe say for like a transitional housing project. I'm also not requesting any operating costs. Again, because this is rapid rehousing, so I'm not requesting any of those costs because I'm not operating a building. I am requesting supportive services. So here's then the supportive services budget request. I have detailed out the dollar amount that I'm requesting and then the description of the details to that dollar amount. So in this example, I'm requesting 1 FTE case manager. So I've given that salary, the benefits, done that calculations, what that comes out to. I'm requesting a part-time job coach. I've given that salary and benefits and what that comes out to. It's really important that we have these details in terms of the budget kind of explanation or narrative. So we essentially know what these dollars are getting us. I'm also requesting a little bit of money for bus tickets. I've done the calculations there. This totals, and again, that total is then carried through to the summary budget at the top. Likewise, in this example, I am requesting some HMIS funding. Every project application can request an HMIS budget line to cover the costs of licenses or your personnel who are doing HMIS activities. So whether you're applying for CoC bonus or domestic violence bonus, you can request an HMIS budget line. Please request an HMIS budget line because use of HMIS is required. So just want to emphasize there is this requirement that you use HMIS, but you can request funding to support that requirement. So please take advantage of that opportunity. So in this case, I'm requesting some funding for HMIS licenses and a part-time data entry position to do the HMIS data requirements. So all of these detailed budgets then again carry over to the top to the summary budget. This automatically calculates my subtotal of what I'm requesting. I then need to add in the amount of administrative costs that I'm requesting. You can request up to 10% of this subtotal in admin. So I've given you a little cheat sheet here. This max admin costs allowed calculates that 10%. So in the next cell, the administrative costs requested, you can either request less than 10% or that 10%. So in this case, I want that full 10% in admin. So I'm requesting that much, that $46,000. If I didn't need that much, say I only needed $30,000 in admin, I could have requested less than that. I would highly recommend that you request your full admin amount, take that full 10% that's available to you. So then this totals the total amount of what's being requested. In this case, it's a little over $514,000. Now we get into match. match is required for all projects. So the spreadsheet automatically calculates what the match obligation is. It's 25% of your total budget minus any leasing assistance that might be requested. The good news is you don't need to do those calculations. The spreadsheet will calculate for you what the match obligation is for your project. So in this case, because I'm not requesting leasing, it's 25% of my budget request needs to be matched. So that's $128,691 that I have to match. In your project application, if you have documentation of your match sources, and if you upload those in your applications, you may earn more points during the review. However, they're not required. You can still submit an application, submit a budget form, even without the match documentation. But if you have it, please submit it. All right, so now we're going to click over to tab C. This is where I'm going to detail out what I'm using for match. So and I will admit that we don't have time today to go into a lot of details on match requirements, what you can be used as match, how you document match. If you need more information on that, let me know. I can send you some resources to help you better understand that. I will say in general, match can either be cash or in kind, and match does need to be able, if it's like either one of those, cash or in kind, it has to be used for an activity that would otherwise be an eligible expense under the CoC program. So whatever you're using your match dollars on, or your in-kind, is something that would otherwise be an eligible expense under the CoC rules. So there are some details there that will be important to understand about match. For our purposes here, what we're looking for on this spreadsheet is simply asking you to delineate what are the sources of match. Again, this is an example, so I just put, some maybe foundation funding. Maybe I have another federal funding source that I can use as match, and I'm getting some general contributions from my organization. These are all cash matches. Some I know are committed, some are estimated. This estimated one, I think it'll be available starting next fall. So that's the date that I put there under when I think they'll be available, giving the total amount of that match amount, and then the amount that is going to be used as match for this project. So as an example here, I have example this other federal funding source. I'm getting a total of $100,000 from them, but I'm only going to use 50,000 of it as match. So you just can indicate that there. You can also use the full amount as match. It just depends on how you are deciding to use that source of funding. We then ask you to describe how that funding is going to be used, general operations, in this case, part of a program director's salary. And then if you have documentation that you will be including with your application. The spreadsheet will then total the total amount of match that you've indicated, and it's going to compare it to the total amount of match that you need. This amount that you need carries over from the other tab of the spreadsheet. So you can do this comparison. I've identified $130,000 in match. I need 128 and some change. So I've met that match obligation. Let's say by way of an example, say I only had this $25,000 in this other source of funding as match. Well, then my total is in red, and that's telling me I've not identified a sufficient amount of match. I need to either take another look at my numbers or make sure I have another source of match in order to, basically get this number into the black, so that I can be sure that I've identified all those match sources. Okay. I'm going to quickly click over to the PSH budget spreadsheet. This one is a little bit more complicated, so it may feel like I'm going through this rather quickly. I will try to get through this in our remaining time. A couple of things I'm going to point out with the PSH one. Tab D in this PSH application is exactly the same as what we just went through. In terms of tab D is where you're going to detail out what you are requesting in this application that you're submitting. So I'm not going to go over this in detail because it looks exactly the same and it functions the same as we just went over. You're going to detail out what you're requesting for rental assistance or leasing or operations or supportive services. And the spreadsheet functions the same way for that tab. The difference with the PSH application or spreadsheet, and all that I'm going over here is also detailed in this instruction page as well. So you can always refer back to that. The first tab of the PSH application, the first and second tab, so tabs B and C, are asking you about information for your total project, your total PSH project, not just this portion that you're requesting funding for. And so it's really asking for a bigger look, a bigger picture of the PSH project as a whole. So this first tab is asking about who are all the staff positions that are going to be assigned and working on this project. We've given some titles here. You may use different titles. If you use different titles, you can swap these out or, provide clarification down here, whatever makes sense to you. But really the question is, who are all the staff that are working on this project? Your program directors, your case managers, your housing supervisor, data entry, any peer support staff that you may have. Who is all working on this project? What is their salary? Annual salary, and what are their the FTE? Is this a full-time person? Is it a half-time person? Do you have 3 full-time case managers? So really taking a broad look at the project. Again, including particularly if you're applying for expansion funding, you're going to include both your current personnel and any additional personnel who may be funded with these additional funds. So this is going to total the total amount of salaries for the project. And the salaries number is going to pull over into tab C that we'll see in a minute. Then on tab B, you're going to indicate the total number of households to be served when the project is at full capacity. And again, this is if you are applying for both for expansion funding, it's going to be both your current number of units and any additional units that you may be requesting. So again, the whole project. What's the total number of units or households to be served? These final column lines that are in orange here is going to automatically calculate based on a ratio of 1 to 20 ratio, which is what we're expecting for new projects. If based on the number of units you've indicated, how many full-time case management staff do you need? So based on that 1 to 20 expectation, if I have 60 units in my project, I need at least 3 full-time case managers. And based on the number of case managers that I've given above, I've given 3. And so this really is just doing this matching comparison to see if I have budgeted for the appropriate amount of case management staff. And here you can see these numbers match, and so that's good. All right, tab C is then where we are getting into your total project budget. So again, more than just the funding that you're requesting within this application. So you can see this salaries number, this pulls over from the prior spreadsheet. This is the total salaries. If you didn't include fringe benefits, you're going to include them here under employee benefits. You're just going to, again, in the interest of time, I'm not going to go through each of these lines, but these, the budget lines given, some of them are suggestions, some may not apply to your project. Or you may have other expenses, other costs for your project. And if so, you can indicate them under, other operating expenses, other staff expenses. But again, the important thing is that we're looking for your total project budget. So that's what we're asking for here. A couple of things that I want to note as well. Let me get through. So the first top of this budget is going to be the expenses. So what is it costing you to operate this project? Once you get to part G, this is where you talk about project revenue. So what are the sources of funding that are coming into your project to cover the costs of all of those expenses that you've just outlined? So this example that I've given here is an expansion application. And so you'll see this line here. If you're an expansion project, you're going to indicate in this cell here the amount of your current CoC grant, your 2023 grant, the one that you are seeking to expand. And the reason why we asked for this is, again, because this budget is your total budget of your entire PSH project. Your current existing grant is part of that. So when we talk about project revenue, your existing CoC grant is part of that revenue. So you need to include it as one of those revenue sources. The rest of Part G is going to be the additional project revenue. So you'll see this cell here, the requested CoC funding, this total is going to pull over from the total amount of funding that you're requesting for this project application. In this example, I'm requesting $619,000 in this application. That 619 pulls through in this tab here as an additional source of revenue for my project. And then I've identified some additional sources of revenues, Medicaid reimbursement, some grant reimbursement, some other revenue, which you're going to detail out on tab E. Okay. Spreadsheet is going to do all these totals. It's going to total your expenses. It's going to total your revenue. And then line H is going to give you that net expenses, net revenue. If you have a negative number here, that means you've identified more expenses than you have revenue. So it's kind of pretty basic budgeting. You want to make sure that you have enough revenue to cover your expenses. All right, I'm going to skip over tab D because we essentially talked about that already in terms of this is where you put the request for this project. The one thing I will point out, this example here is for an expansion grant. And so because of that, I also want to know my total match obligations for this entire grant, both what I'm currently receiving and what I hope to receive. So therefore, I have indicated my match obligation for my existing CoC grant is $162,500. So that's the one piece of information I've plugged in there to give me my total match obligation for everything combined is $317,000. Okay, I realize I'm going quickly. Apologize. I do want to get through these final two tabs before we go. So tab E and tab F are there where you're going to detail out your match. So it's going to, again, pull from the other parts of the spreadsheet. It's going to pull, these are the other sources of funding that I identified on tab C, this Medicaid reimbursement, this grant funding, this other source of revenue. It pulled it over and the spreadsheet's like, this is another source of funding. Are you using this as match? And so you're going to work through the questions on this spreadsheet to really identify how that funding is going to be used and whether or not it's going to be used as match. Maybe you have just another source of funding that's not going to be used as match, which is totally fine. But for those that are going to be used as match, you're going to indicate that in this spreadsheet. Just you're going to answer this question. Will this source of revenue be used as match for this project? Yes or no. How much of it is going to be used as match? That total will then pull over into tab F, where it's going to total your cash match. Again, that's auto-populated from tab E. And then if you have any in-kind match, you're going to indicate that here as well. So in-kind, again, don't have the time to go into in-kind match, but it's essentially, goods or services that you're receiving for the project. In this example here, I've given, we're getting some pro bono legal services and some, free financial literacy courses. It's just an example. But those are, valued at $18,000, $14,000. That's, again, a lot more could be talked about how you put a dollar amount to that, but for our purposes, you put a value to it. And those are included as the value of my in-kind match. Adding my in-kind match plus my cash match gives me the total. And again, it does this comparison just to see if I'm meeting that match obligation. The final tab G, gives details on the eligible costs. This is taken straight from the regulations in terms of how the funding can be used. Okay, we are at noon, minus a couple of breaks for my internet outage. So I see there's a question in the chat. So the question would be, first-time applicants, can you comment more on the 1-year timeline? Approved this September, but funding is not received until late 2025. When should your timelines begin? Yep. So if you're funded for the first time, so again, the budget request that you're submitting is for a 1-year budget. That is all built into these calculations with the spreadsheet. So if you're funded, you get this funding, it's going to be for 1 year. And again, our best anticipation is that the new funding will be available, ready. You'll have your grant agreement from HUD. The funding will be ready to start spending, again, like fourth quarter of 2025. So say October 1st, 2025. So, and there's a question in the application that relates to this too, in terms of, let's say October 1st, 2025 is your start date. That's when you can start serving people, taking referrals, and implementing the services. There are some questions in the application that are going to ask you, how are you going to prepare and get ready so that by October 1st, you are essentially ready to go? What is the work that you will need to be done ahead of time to get you ready for that start date? And how will you cover those costs? Because your CoC funding won't be available up and prior to then. So those are questions in the application that you'll need to think through. And so again, I think getting to the question of when would your timeline begin, would anticipate beginning October 1st of 2025. So I hope that answers that question there. I want to acknowledge too that I went through this PSH budget really quickly. If you are applying for PSH funding, and once you get into this budget spreadsheet, it all feels like heads and tails, reach out to me. I'm more than happy to have a separate meeting to kind of walk through more specifics of how this spreadsheet works or what information we're looking for. Because I realized I did kind of go through it pretty quickly, just in the interest of time. But I'm more than happy to go through it in more details. So we're a little past noon, so appreciate you hanging in with me here. We can certainly answer any additional questions. If you have other questions that come up as you get into the application, as you're working on it, please reach out to me. My contact information is here. Don't hesitate to reach out. If you're asking a question that I can't answer, like if you're asking a question that would, give you like an unfair advantage or something over someone else, I may not be able to answer. But for the most part, the questions that I get, I am able to answer. So don't hesitate to reach out. Okay, I will pause. Again, I apologize for the wonkiness of my internet. We will get this recording all together, all in one recording, so you can review it again if you need to.